Good evening and welcome to IW Council's special web show, Tone of Life, where we will discuss all aspects related to high cholesterol, symptoms, causes, treatment, and more. The IW Council is dedicated towards raising awareness about one's health and well being. And today we're going to talk about the problems associated with high cholesterol, how they are diagnosed and treated. This show is powered by Lupin. Very recently, the entire nation was mourning the death of the famous singer KK, who passed away due to cardiac arrest post a concert in Kolkata. Some experts warn that India will have the notorious distinction of recording the highest number of cardiac deaths by 2030 in the world. Studies have shown that elevated cholesterol is an established risk factor for heart disease. If your cholesterol is too high, it builds up on the walls of your arteries, making them narrower over time, which reduces blood flow to the heart. There is also increased risk of developing other medical conditions like stroke, peripheral arterial disease, type 2 diabetes, and high blood pressure. In our special show today, we are joined by an expert who will help uncover all facets of high cholesterol, its impact on health, and what can be done to prevent it and treat it. Please welcome Dr. PP Mohanan, Director and HOD of Cardiology, Westport High Tech Hospital, Thrissur, and immediate President of Cardiology Society of India. A warm welcome to the show, Dr. Mohanan.
Thank you, Anisha, for those kind words.
A quick introduction of Dr. Mohanan. He is, of course, the HOD cardiology at Westport High Tech Hospital. He completed his MBBS and MD in internal medicine from Calicut Medical College, and then he has obtained the DM cardiology super specialty qualification from PGIMER Chandigarh. Of course, he's feted and has received many awards. Thank you so much, Mr. Mohanan, for joining us. Now, I want to understand what cholesterol is, because the body needs cholesterol and the liver produces cholesterol. So, the body does everything right. How do we land up with high cholesterol then?
Just before that, you have highlighted the problem in your introductory remarks pretty well, Anisha, when you said the cholesterol disorders. I will rephrase it something like the lipid disorder, because people have always a confusion that cholesterol is equal to lipid. Cholesterol is part of lipid, but it's only one of the ingredients of the lipid. That is the thing that one has to realize. And lipid disorders are one of the most widespread metabolic disease worldwide, and especially so in our country. And that leads on. We know that the cardiovascular disease is the number one killer in our country. And if you take all the risk factors, there are supposed to be about 9 risk factors or more. But if you ask me, which is the most important amongst them, I can very well say, now there is some sort of a scoring system by which you say, is diabetes the more important, hypertension, smoking, or lack of exercise? But possibly the scientists will say dyslipidemia or cholesterol lipid disorder has the maximum population attributable risk for artery disease. So cholesterol disorders are the most important thing. You asked me second as now it is an essential component. The liver manufactures. In fact, liver manufactures. We need it for the cellular integrity, for our hormonal function, for our brain function. If you look at every tissue of us, it requires a smaller amount. For example, when the baby is born, if you look at the cholesterol level, you can see the LDL may be something less than 50. So cholesterol is needed. We all need cholesterol, but an excess amount brings out the problem.
All right. Dr. Mohanan, you spoke about the problem with lipids, but the common general population knows this as a problem of cholesterol. Plus, to confuse them further, there's something called good cholesterol and bad cholesterol, LDL and HDL. So you're completely confused because you go to the doctor and doctor says, and get a lipid profile done. And they're like, lipid profile, I've heard of cholesterol, good, bad, high, low. So it's a little of a maze for people. Could you explain this to us? What is LDL, HDL? How does this fit into the lipid profile?
Okay, right. So, I mean, lipids as such has very many components. It has fats. You are aware of saturated fat. You are aware of unsaturated trans fat, which is one of the deadly fats, causing all sorts of problems. So amongst the, and then oils, you have umpteen number of all the colors of rainbow oil in our country, and we are one of the highest consumers. You yourself know. I suppose you cook, and it is the oil and the salt which gives the taste to the food. And especially our Indian woman finds their man's love through their stomach. And they give all those tasty preparations and feed us so much that, so, I mean, beside the point. So when you test your cholesterol, basically we estimate the total cholesterol. Then amongst them, there are, cholesterol always traverses in the blood with a lipoprotein. So you have a high density lipoprotein, HDL. You have a low density lipoprotein, LDL, sometimes a very low density lipoprotein, and then triglyceride. So there are very many sub-fractions about that. The most important thing, matter. Look, you don't need to look at everything, but it will be better to check your total cholesterol and your LDL cholesterol. And also, I mean, you mentioned about the good cholesterol or the HDL cholesterol. We were all thinking that if you have elevated good cholesterol, well, our heart is good. I mean, in a way, it is correct, but now a very high good cholesterol is also bad for your heart. And now, naturally occurring good cholesterol level, let us say if your HDL is around 50, 60, that's okay. No problem. But if it crosses 100, that is not good for you. That's why drugs which increases your HDL doesn't work. So I suppose I am not confusing you, but when you do your lipoprotein, concentrate on your total cholesterol level, LDL cholesterol level. These are the most wellness cholesterols in our body.
But Dr. Mohanan, I am a little confused. Now, LDL, you said it's low density, and the cholesterol has to stick to either the lipids to travel in the vein.
Yeah.
But we've also heard of a ratio of LDL and HDL, and that is also important to determine your heart health. So, is HDL the good cholesterol? And if that ratio is higher than the bad cholesterol, are you still okay?
I mean, basically, there are the ratios were possibly given too much of importance in the presumption that HDL is a very protective cholesterol. See, that was the time evolves, and now we realizes it may not be giving us too much protection to your heart. So the ratios are losing its importance. So it is true that a ratio of total by HDL cholesterol. Okay. So when your HDL is higher, you have a lower ratio. So it is always good. But mind you, the importance given to the good cholesterol is gradually ebbing away. So much so, we don't know whether the so-called good cholesterol is the correct term. But LDL continues to be the bad one.
So basically, the bottom line is to keep entire cholesterol under check. It should not be high. It should be closer to what the body produces, right?
Sorry, what did you say?
The level of cholesterol should be closer to what the body produces, not much higher, right?
We have now various guidelines. Now, because in a child, the cholesterols are always lesser. As we grow, we accumulate cholesterol. So if you have no disease, no risk factor, okay? So then you can go up to your total cholesterol go up to say 160. No problems on that. If you have no disease, your LDL cholesterol can be something like 115, 130. If you have no disease, no other risk factor, you are perfectly okay. But if you have a disease, then the whole thing changes. We have to have the lowest. We will discuss it later.
Right. So, Dr. Mohanan, in between you were talking about way to a man's heart is to his stomach. Now, what has cooking got to do with getting bad cholesterol? See, you said that over our lives, the amount of cholesterol circulating in our body keeps increasing. Is it because the body is producing more, or is it because something about our diet is leading to higher cholesterol?
Diet is absolutely important. The problem came, Anisha, you must have possibly remembered the lot of controversy happening about 2 or 3 years. Yeah, cholesterol is not important. We have all the importance given to cholesterol is gone. This all happened because people took cholesterol is equal to lipid equal to fat. See, that is the problem. Cholesterol is a separate entity. Fats are a separate entity. So they are all different. For example, saturated oil, fats and oil. We consume a lot of oil. Even though the recommendation is 15 ml of oil per day. If you can ask me, I can go on and on, talk about which is the best. Unfortunately, we don't have a perfect cooking oil. The perfect cooking oil should have a ratio, a ratio of N3, N6. I don't want to confuse my audience by talking too much about that. But the basic principles are restrict your saturated fat, like ghee or your palm oil, coconut oil. Now, any oil which has saturated fat, you restrict to even less than 10% of your consumption. So try to use more polyunsaturated fatty acid oil, PUFA. Now you definitely look at your bottle of oil and you see PUFA is this much, saturated fat is this much, MUFA is this much. We should be looking, when we buy oil, we should be looking at the proportion of this oil. So if you ask me which is the best one, a MUFA is best one. Now, monounsaturated fatty acid is possibly the best oil. They had the Mediterranean diet. You would have heard about the Mediterranean diet. They uses more of olive oil. Olive oil contains mostly
high MUFA.
The problem with olive oil, we can't deep fry. We like deep fry. You can use it in salads. You can use it in others.
But you said, Dr. Mohan, 15 ml of oil is what an adult should have. What is the average that you have, that a normal, say, a North Indian diet would have on a daily basis?
15 ml is 1 tablespoon. See,
per
basically, 1 tablespoon per person per day. Okay. So the scientific explanation is there is no problem in taking saturated fat. Only thing is you have to limit it. I'm not here to say don't touch coconut oil, don't touch ghee, nothing like that. If you're a healthy person, you can take, my teacher used to say, you take 5 ml of saturated fat, 5 ml of PUFA, 5 ml of MUFA. In a house, it is not that easy, you cannot do that. So basically, that is why you have mixtures of these oil. For example, if you look at rice bran oil, or our postman, or some of these oils has come as a mixture of very many ingredients, which has possibly the best ratio of N3, N6.
Or perhaps what we can do is that we can have a variety of oils to cook. Some sabzis are cooked by mustard oil, some sabzis are cooked in olive oil. According to, so if we bring in a variety, then perhaps we have a decent mix. You think so?
So that is one. We forgot about that, your question about cholesterol thing. See, cholesterol from diet comes from egg yolk. Okay. Some of those, the sea fishes, prawns, other things. So the dietary cholesterol's contribution is limited generally in our diet, especially in the vegetarian. They eat more of saturated fat and MUFA, PUFA. Okay. So when the American Nutrition Guidelines said dietary cholesterol has not much role in your disease. Everybody thought, oh, dietary fat has no relation. That was the whole problem. And people thought, oh, I can eat anything. No. Dietary cholesterol, which means egg yolk, prawns, on the importance. Earlier we used to say you take only 100 grams of dietary cholesterol, which means if you take one egg, that is 100 milligrams of dietary cholesterol. So that has gone out, meaning that you can eat your egg, no problem. You can eat some prawns, no problems.
But why is cholesterol becoming a health issue? Because our diets are not very different, right, from what perhaps are they are a little different because we're taking more processed food. But for those households which still have dal, roti, rice in their meals, why are we having a problem with cholesterol? Is there a genetic link to it? Are Indians more predisposed?
Yeah, there is actually. Now we are understanding more about genetic dyslipidemia, especially with the newer methods of DNA testing. But generally, that you will see only 1 in 250, 1 in 350 people. But all the 349 people or 249 people is basically also because of our lack of exercise. And there are very many factors. It is not your diet alone, but diet is important. Your consumption of saturated fat, for example, if I start, I'm from Kerala. Our staple oil is coconut oil. Even though it has some advantage, it's a little different from the conventional saturated fat like palm oil. It is also deleterious if I take it in excess. It will be absorbed, and my cholesterol level is definitely going to, people have used very many experiments and shown if I take more saturated fat, my LDL level goes high. There is our consumption of oil in our cooking is absolutely high. Then we don't exercise and we have more diabetes. And so all this put together, we develop atherosclerosis fast. We develop shrinkage of our vital vessel. We develop heart attack. We develop stroke. We develop renal failure. We develop peripheral disease. So diet is one of the most important things. And we have to realize that our consumption has to be moderate.
And our lifestyle has to be good. But Dr. Mohanan, on an individual level, there may be higher risk factors for those whose diets or lifestyles are not good. But on a public health basis, why is this becoming such a concern? Because traditionally, India is a country where the problem has been of malnourishment, not having enough to eat. In such conditions where a large population perhaps still doesn't have a very fat-rich or oily diet, is this still a problem on a public health basis?
You hit the nail when you said our consumption of fat is inadequate. See, 30% of your calorie, a normal person will require about 2,000 to 2,500 calories. 30% of your calorie comes from fat. And when we took a survey, we found that only 18 to 20% of your calorie requirement is coming from
fat.
But that is not that's only one issue, and that's only a small proportion of patients. Majority of our people has, for example, the ICMR study, the pure data, our own data, all the data shows our people has some forms of dyslipidemia. It need not be total cholesterol alone, because we take more, even though the allotted carbohydrate percentage is 60%, we take much, much more than that. And that the rest of so whatever excess carbohydrate you're taking is stored in as the triglyceride, and naturally
in the liver.
It goes back into. So even though we may not be taking the exact forms of oil, we have now your proportion of the food items, whatever you are giving me in my platter is not very healthy.
Okay. Dr. Mohanan, is it then safe to say that only obese people have a cholesterol problem?
No. Because if you take obesity proportion in India is about maybe about 40% or 35 to 40%, and maybe about 50 to 20% in the children. In children also it is increasing on as leaps and bounds. While dyslipidemia, in all the studies, some forms of dyslipidemia is seen in about 70% of people. See, only some 25 to 30% of Indians has a normal lipid profile. 70% of them has some form of, it may not be the typical that we see in the white man, but like a low HDL, increased triglyceride, a borderline increase in the LDL. So we have, you said about genetics also, so that also matters. So we have a preponderance of dyslipidemia in the Indian population.
Dr. Mohan, what are the signs of high cholesterol? Because does it manifest itself? Like if I have some lung infection, I start coughing, or if I have digestive issues, I may go to the toilet more often. What are the symptoms of high cholesterol, or when it really starts causing a problem?
Unfortunately, there is a major problem. Increased cholesterol levels in your blood definitely doesn't manifest acutely. When it accumulates over years and years and years, then it manifests as heart attack, stroke, peripheral arterial disease. We were talking about the genetic dyslipidemia. See? Now they are called familial dyslipidemias. These groups of people, but then they are a small minority. They may have some peripheral signs of increased cholesterol, just like a scleral change or small deposit over your eyelid or in your over joint spaces. So some of the some tuberose, certain skin changes. These are seen only in the familial type of hypercholesterolemia or dyslipidemia. They are not seen in the large proportion of elevated cholesterol. They are absolutely asymptomatic.
You're saying it's a silent disease. It will not manifest.
Silent, like hypertension. See, hypertension, at least you can measure simply. Cholesterol, unless you prick and take the blood, you will not know. That is the problem with cholesterol. Okay.
Say I did go to the doctor, got my lipid profile done, and I had a bad result, showed high cholesterol. Then what happens? Is only diet and lifestyle modification the way to treat it? Are there medicines? Because you spoke about the controversy of the statin. After that, a lot of people started discounting the importance of cholesterol. But what is the treatment there if you have high cholesterol?
See, the most important thing that we have to observe, we discussed about the diet. Now, there is something called a diet heart hypothesis. Diet, and that is the one major reason for your, and that still holds true. No, it has not gone away. Your diet is your principal way by which you develop increase in dyslipidemia. So the most important thing to start with is dietary, eat a healthy diet. Lot of vegetables, fruits, any number. No, legumes and restrict your the standard, which everyone knows generally. If you just Google anything, you see a standard diet for everybody. Healthy diet. Eat a healthy diet. If that no, you have an absolutely healthy diet. I talked to you about the importance of fat even at the beginning. So we should also eat fat. Have a good exercise every day, at least 30 minutes of exercise or some aerobic exercise. So these you don't avoid smoking, and if you're a diabetic, you take care of that. Diet and exercise will be my principal advice initially. Then depending upon your cholesterol levels, if you see diet and exercise can bring down maybe about 10% or 15% of your elevated cholesterol level. But if I want to bring down a 50% reduction of your cholesterol, let us say your cholesterol, your LDL is something like 200. I cannot just ask you, just simply do a diet and exercise.
A diet. Okay.
But first thing again, I will request you to do the lifestyle modification and then go for drugs. We have fantastic drugs to reduce your cholesterol. They're not very expensive drugs. We have also expensive drugs. Statins are available from 1984. We have the proof of the importance of statin almost now, say, 30 years. Still, people worry about statin, which is very, very unfortunate. You have only statin to protect your heart. Earlier, people, if I have no disease, okay, if I have, but I'm 50 years, I have elevated cholesterol, which is not coming down to. So to protect my heart, I take a cholesterol lowering drug, I take an aspirin. So these are the conventional treatment that we used to give. Now aspirin has disappeared because for primary prevention, now people know that it may do more harm than good. But statin continues to be the most wonderful drug.
Okay. Dr. Mohanan, then statins are just taken orally and that is the treatment?
See, your step one. And basically, I told you about all our decisions on basically in your cholesterol levels elevated are centered around your LDL cholesterol. We don't need to look at multiple things. So for simplification, you just look at the LDL and decide on what percentage of reduction you want. If you have 200, I will want a 50% reduction. So I will give you a high intensity statin, which will produce a 50% reduction. And your cholesterol will become maybe 100 milligrams absolutely without much. I mean, I do agree. There are adverse events. But if I can give you a simple math. If 10,000 patient or subject, not patient, they are not patient, subjects are treated for 5 years with statin, I prevent 1,000 heart attacks and 5 cases of some muscle pain and muscle myalgia, and some 50 to 100 cases of some elevation in your blood sugar.
Okay, so the benefits outweigh the cost.
The advantages are substantial than the disadvantages.
Okay. How on an average basis for an average subject, what is the course of the treatment? How long does it have to be? Say, because you will follow it up with dietary and lifestyle modifications as well, right? So for how long do I take the medicines and then get on to diet and lifestyle?
Cholesterol disorders is a metabolic disease like diabetes. For diabetes, you take a lifelong treatment. For
chronic treatment,
you take a lifelong treatment.
Just so it's like a chronic treatment.
It's a lifelong treatment, but it is not necessary. So I told you about the percentage reduction. I will give you a patient a higher dose initially. Then, depending upon the cholesterol level, we can down titrate. If there are many of my patients who take one alternate days or twice a week, no, it is possible. We can bring it down. And if you keep a very healthy levels, people have an obsession in their mind, basically created by these statin baiters. You have seen the vaccination baiters, vax baiters. Same way, there are many people amongst us. Oh, if I take a statin, I will develop diabetes, I will develop a stroke, I will develop muscle. See, look at the advantage you are. And we don't have anything but statin to protect your heart. A healthy person has nothing but a statin to protect your heart. And of course,
lifestyle and good diet. Dr. Mohanan, you said that in our country, 70% of the people have something wrong with their lipid profiles. So do you think there is enough awareness in our country? Are people getting themselves tested, the lipid profiles done regularly, and then taking proactive measures to ensure that the situation doesn't go out of hand? Why I'm asking is because my mother had met the doctor and the doctor said, oh, your cholesterol is very high, you must be obese. She wasn't obese. She took the medicines for a short while and later on the doctor told her she had fatty liver also, and she ignored it. She said it's okay. She still eats a lot of ice cream and like she's not making many changes. Do people take this seriously?
I think people have to take it seriously. It is basically because we know about, maybe we have more we are more sure about diabetes and hypertension than dyslipidemia, because now you also remember that we all preferred chubby babies. We all preferred. We don't prefer fat men, I know, but generally now people always attributed a little bit of obesity with
chubbiness with good health. Yes.
So that was the wrong notion, and we know that obesity is only one of the factors, but a large number of people has to be. We have to do more opportunistic screening, something like BP taking, something like your blood sugar taking. We should be checking our cholesterol
Lipid as
also.
well. Okay.
One of the additional problem was, while we suggest to take blood pressure of even a child, or at least if you're 18 years old, there very many recommendations for screening for cholesterol starts at not a young age. It's at 40. See, many of so that should change. Now we have to be, now the youngsters are developing more and more heart attacks because of very many reasons. Lack of exercise. Sitting is now the new smoking. See,
Yes.
and they don't exercise at all. They definitely substance abuse, the bad pollution status in our country, apart from the conventional risk factors. So we should be doing the screening even at the age of 18 to 20 years. Only do it about once in 5 years. See, if you have no disease, if you're a healthy individual, do a cholesterol testing in once in 5 years and start early.
All right. Thank you so much, Dr. Mohanan, for joining us and talking to us about the issues associated with high cholesterol and how this is becoming a major issue in our country. Let's hope the programs like this will help increase awareness and people take health in their own hands, proactively seek a diagnosis if there may be. If they suspect the diets and lifestyle are not good, that they may have a cholesterol problem, let's hope people take proactive steps to get it diagnosed and then treat it expeditiously, and then go on to prevent further complications of heart, stroke, and other diseases. Thank you so much for joining us.
And one last word. My request to every listener will be, know your number. Know your blood pressure number, know your blood sugar number, know your cholesterol number, please.
Okay, that's great advice. Thank you so much, Dr. Mohanan, for joining us. Pleasure having you with us on the show.
Thank you. Appreciate your kind words. Okay.
With this, we will wrap up this special show on high cholesterol. The show was brought to you and brought to you by Chapel Council and supported by Lupin. Do follow us on Facebook to stay updated on all the shows that we come up with and all the concerns of your health and well-being. We'll take your leave. Goodbye and take care.